mortality rate was where we landed. It is one of the best predictors of a community's overall health, and unfortunately it's also a predictor of its failures. First and foremost, because it takes a child, it takes our human capital from us as a community before the age of 1. Here in Fresno County, as many of you probably saw in the Fresno Bee today, this is the most recent data that came out. The Healthy People 2020 objective is to have no more than 6 per 1,000 births. In Fresno County, from 2007 to 2011, we increased from 6.5 to 7.8 countywide. So we're not on the right side of this trend. And this says a lot about the overall conditions of our community over that same time period. It's also a huge predictor of socioeconomic disparity. So what do we mean by that? When we look at different groups and we look at the disparities between them, infant mortality is something that tells us what's going on with that. Here in Fresno County, the African American infant mortality rate is 3 times that of the rest of the community, and it is 354% above the Healthy People 2020 objective. It has gone up 91% and now currently stands at 27.3. So for our African American babies, 27.3 per 1,000 don't make it to their first birthday. And when we think about what contributes to that, and more importantly, the other things that it indicates, these are all of the things that go into that. They are not the only things, but they are rather significant things that go into determining our infant mortality rate. So again, when we look at poverty, 1 out of every 3 children born in this county is born into poverty. Our birth rate is just about a little over 16,000 births a year. So think about that. We have 16,000 births a year in Fresno County, and 1 in 3 of our babies is born into poverty. As you saw earlier in the video, the head of household, female head of household, is an indicator. It is something that we look at, and in Fresno County, it is much higher than throughout the state, and it's particularly higher for communities of color. Mom's education is also something that is pretty significant. And when you look at that and you think about why, this is what we see. We just recently had some data that we looked at, and time again, what we saw was that mom's education level had a direct impact on what we saw. And so when we think about that, and we think about the female head of household, that's a very stressful environment that our families are living in. My husband's in the military, he serves full time, and he was gone for 9 months. I was a woman with an education, I had resources, I had transportation. It was the most chaotic time in the life of me and my children. Even though I knew what was best in terms of parenting and all of that, I did not have my most stellar mommy moments during those 9 months. My children were often sitting in front of the television once their homework was done so that I could get done what I needed to do. So even with what I had and the access that I had, it was an incredibly chaotic environment. And I remember us doing the countdown thinking, oh my gosh, I cannot imagine if this was my norm. So that is the reality. When we look at these statistics, when we say family structure, you look at the number of single female head of households. And more often than not, these same females are in poverty, or they're lacking education, or they're struggling with resources or transportation. So these are huge, significant factors that play into the well-being of our babies. You look here at our crime. There's a book called Ghosts from the Nursery that I highly recommend you all read. And Howard Watkins, who's here today, has done a paper on it, and it will make that available as well. It talks about what happens when our babies are not in healthy environments in utero. It talks about what happens when our babies are born into poverty, into chronic stress, into communities of crime, that is when we see our very, very young children starting on their path of criminal lifestyle. And then we think about unemployment. What happens when our kids are in families with high unemployment? In Fresno County, 15%. In the state of California, 1 in 3 children is born into a home where neither parent has full-time employment. So imagine that. When we have a community with unemployment rates as we do, this is the risk to kids. In the Housing Authority, of which I sit on that board, we just, in looking at data, discovered that 25% of our families are in move status at any given time. You think about what that means to a child who's trying to settle down into a school, into a community, into a neighborhood, to making friends. All of those things play into that. So here's in a nutshell all of the contributing factors when we think infant mortality. It's not just about prenatal care and healthy birth weights. It is all of these things. And so, as you just saw in our stats, the bad news is we have a pretty heavy lift. But the good news is we know as a community what we need to do to change these things. So how do we impact that? Through our education, improving our education rates, improving the nutrition, the safety, the stability of families. Because what happens when we experience that is there's lasting effects in families, there's lasting effects in communities if we do not get this right. I was born 10 months after my brother died of sudden infant death syndrome. He was 3 months old, and back then they didn't know. They didn't know that being in a home with a lot of smoke was a risk factor. My parents were in the Navy, they commuted to Lemoore every day, and so they were left. They had no choice, newly married, to leave their baby with a neighbor who smoked in the home. He was on his stomach, which we now know is a risk factor and contributes to SIDS. So there was things that we know now that we didn't know then that contributed to that loss. But in addition to losing him, there was significant impacts on our family. My sister, who was about 2 years old at the time, she struggles today with depression. She struggles with other issues that she has been able to, as a family, we've traced back to that early childhood trauma. Back 38 years ago, they didn't know that a 2-year-old, they thought, oh, well, she probably won't even know what's going on. They had no idea the impact of that loss, the trauma on a little girl who couldn't comprehend what was going on in the world around her. That has stayed with her throughout her life. It was part of our family growing up. It was part of the discussion. It was part of what defined who I was. My parents often called me their double portion, which put a huge burden on me to try to do the part for both me and for him. So when we think about that loss, it's not just about losing that one child. It is the impact on the community. The caregiver, he died in her home. She left, they moved, they couldn't stand to bear the loss because she felt that she was at fault and still to this day struggles with that. So when we think about what happens and those contributing factors that go into our babies not making it to their first birthday, these are all very significant things that have ripple effects and lasting impacts in our community. But we know what to do. We know how to fix this. The education piece. School readiness is critically important. And as you saw in the video, we recently had our big school districts commit to doing something called the Kindergarten Student Entrance Profile. And that measured the readiness of our kindergartners. Over 70% of our kindergartners were rated this last fall. Less than 38% were considered ready to go. Less than 38%. So that means that we have a lot of work to do if we know that our kids are starting school on a track that's not going to get them off on the right foot. But we know that preschool is an answer to that. Of those same kids, those that went to preschool were twice as likely to be ready to go than those that weren't. That's pretty significant. Breastfeeding. We've got to get over our cultural issues with breastfeeding. Verse 5, one of our big initiatives is breastfeeding, and I am blown away every time I work the table out at community events. People who can't even walk over to the table because they're embarrassed because it's a breastfeeding trailer. This is something we know is good for babies. We know it's good for bonding and attachment, and we know that it's good for our community. And best yet, it's free. So we need to make sure, right? That's something that we can fix. When we talk about what we can all do as individuals, every one of you can encourage the women in your life that are of the childbearing years to breastfeed their babies, because it's something that is going to contribute to the overall health and well-being of this community. We rank 41 in the state of 58 counties, and our rates among African American, Hmong, and Latino are even lower. So this is something that we all need to get behind as a community. Again, we talked about stability. That's a lot of moving for little kids to do. And when you think about having to, you go to a meeting and you don't know anybody, we're adults. I know this for me, you're a little nervous, you're in there, you don't know who the people are, you don't know the players. Imagine a child that's starting over 2 or 3 times a year, and they're trying to build confidence and self-esteem. They're trying to build a sense of community, and they're constantly moving. That's something, again, that's a predictor of our overall well-being. And safety. Unfortunately, in Fresno County, our maltreatment rates continue to be high, and if you look at that, under 1 is when they're the highest. Our babies, our most vulnerable babies, are at the greatest risk of suffering extreme abuse. And how these things all tie together, I came across a study that was done out of UC Berkeley that was looking at the risk factors and the predictive factors of determining whether or not a child would be involved with child welfare. So of all of the things we typically think about, whether it was a Medi-Cal birth, whether the child was in poverty, whether the father was present or not, the #1 predictor was mom's education. Her not having a high school diploma was #1. Her only having a high school diploma was #2. So again, when we think about all of the efforts, all of us are part of the efforts for child abuse prevention, when if we would invest and make sure that we are graduating folks, especially our young moms, that is one of the #1 ways that we can keep our kids out of the child welfare system, that we can reduce costs that are associated with that, and most importantly, that we can keep them safe. So again, what will happen if we do nothing? There was a great quote by Dr. Kapitman in the paper today. And as we were talking about this, he really talked about infant mortality rates being the canary in the coal mine. So when we look at that and say, they're really telling us that something's not right in our community. And when we have infant mortality rates that have increased 20% countywide since 2007, and 91% for our African American babies, I think the canary's already dead in that case, right? That means that we are not on the right track in this community, and we need to turn it around. And as he stated, what kind of community do we want to live in? We want to live in a community where we can have children born, where as a mother who's pregnant, that you don't have to worry that your odds of your child dying before their first birthday are high because of where you live? Or do we want to be in a community that values the health and well-being of all of our children, and that is on the other side of that trend line when it comes to how we're doing with infant mortality, excuse me. So in closing, this is something that we really need to talk about. When we talk about disparities, I was thinking about this last night, and I thought, we have huge disparities among African American in our child welfare system, amongst the suspensions and expulsions in schools, as well as our dropout rates. What is that telling us when you look at that they have an uphill battle from the time they are born? Just the chance that they will make it to their first birthday is significantly lower than the rest of us. So while this isn't just about African American babies, this really does tell us that we need to have some serious conversations in this community about ensuring that every single child, regardless of what zip code they're born in, regardless of the color of the skin, that they have a chance to succeed, that they have a chance for opportunity, and they have a chance to become a contributing member of this community. And I will leave you with that.